All right, let's dive into something you might not even feel, but that has a huge impact on your health.
Okay.
Hypertension, better known as high blood pressure.
Right.
You know, even if you feel fine right now,
Yeah.
this is a deep dive worth paying attention to.
Absolutely.
Because we're going to arm you with knowledge
Yeah.
that can really make a difference in how you approach your well-being.
I think that's right.
We're talking about taking control, understanding the silent threat that hypertension poses, and just getting a better grasp on what's going on inside.
You know what's interesting?
Yeah.
High blood pressure is often called the silent killer for a reason.
Oh, yeah.
You might be feeling perfectly healthy on the outside,
Yeah.
while on the inside, it's quietly doing damage to your arteries and setting the stage for some serious health problems down the road.
It's like a ticking time bomb, right?
It is.
And nobody wants to be caught off guard.
Nope.
Let's start by understanding just what we're dealing with here. What exactly is blood pressure?
Imagine your arteries are like highways, and your blood is the traffic flowing through them.
Okay.
Blood pressure is simply the force of that traffic pushing against the walls of those highways.
Okay, that makes sense.
Yeah.
And we always hear about those two numbers,
Yes.
systolic and diastolic.
Right.
What's the deal with those?
Right. Those numbers tell us two different things.
Okay.
Systolic, the top number, is the pressure when your heart is pumping, pushing the blood out and sending it on its journey through your arteries.
Yeah.
Think of it as the rush hour traffic on our highway analogy.
Okay.
Diastolic, the bottom number, is the pressure when your heart is relaxing between beats.
Okay.
That's the calmer, quieter time on those arterial highways.
So it's like measuring the heart at work versus at rest.
Yes.
And we hear 120/80 tossed around as normal.
That's the general benchmark, but remember, everyone's body is different.
Right.
Your ideal blood pressure could vary based on your age, health history, genetics. All sorts of factors come into play.
That's a good reminder for everyone listening.
Yeah.
These deep dives are for your information, but your own health journey is unique.
That's right.
So we've got this highway system.
Yes.
We've got the traffic flowing, but what happens when things get congested?
Yeah.
That's where hypertension comes in, right?
Exactly.
Yeah.
Hypertension is when that pressure in your arteries becomes consistently too high.
Okay.
Think of it as chronic traffic jams in your circulatory system.
Okay.
It's not just about having a slightly higher reading once in a while. It's about sustained pressure that puts stress on your entire system.
And that's where those stages of hypertension come in.
Exactly.
Stage 1, stage 2, it sounds like things get progressively worse.
Exactly.
Okay.
Stage 1, hypertension, is diagnosed when your systolic pressure is consistently between 130 and 139.
Okay.
Or your diastolic is between 80 and 89.
Okay.
Stage 2 is when those numbers climb even higher to 140, over 90 or above.
So stage 2 is essentially like gridlock on those arterial highways.
Yeah, you could say that.
It can't be good.
Not at all.
No.
And what's tricky is there are two main types of hypertension. Primary and secondary. Primary hypertension, which is also known as essential hypertension, is like a mystery traffic jam.
Okay.
We don't know exactly what's causing it.
Yeah.
It usually develops over time and seems to be linked to things like diet, lack of exercise, and even stress.
Like the traffic gradually builds up and you're not even sure why.
Right.
Yeah.
Then there's secondary hypertension, which is more like a traffic jam caused by a specific incident.
Okay.
Like a major accident or road closure.
I see.
This type of hypertension is caused by an underlying medical condition.
Okay.
Like kidney disease or sleep apnea.
So it's like a symptom of something else going on.
Precisely.
Okay.
And this highlights why it's so important to get to the root of the problem. Figuring out the cause is key to effective treatment.
Which makes sense.
Yeah.
You can't clear a traffic jam if you don't know what's causing it.
Exactly.
But here's the thing that makes hypertension really scary. Sometimes there are no warning signs.
Right.
No flashing lights or detour signs to let you know something's wrong.
That's right. One of the most dangerous things about hypertension is that it often doesn't have any noticeable symptoms.
Wow.
Especially in the early stages.
Okay.
You could have elevated blood pressure for years.
Yeah.
And feel perfectly fine.
So you might be cruising along feeling great, but underneath the surface, those arteries are taking a beating.
Exactly. And that's why regular checkups are so important.
Yeah.
Getting your blood pressure measured is like checking the traffic report.
Okay.
It gives you a snapshot of what's happening in your body.
But if there are no symptoms, why is hypertension so dangerous?
Why
It's not like a few traffic jams are going to cause a major catastrophe.
Well, the problem is that high blood pressure causes damage gradually over time.
Okay.
Those persistent traffic jams in your arteries can start to wear down the roads.
Mm-hmm.
Your arteries can become stiff and narrowed, like highways with potholes and reduced lanes.
And that's when things start to get serious.
Exactly.
Okay.
While you might not feel any different at first, this damage makes your heart work harder and increases your risk of serious health problems down the line.
So it's like ignoring those potholes and lane closures until they cause a major accident.
Precisely.
Wow.
And those accidents can manifest in various ways.
Yeah.
Heart attacks, strokes, kidney damage.
Oh, gosh.
The list goes on.
Okay. This is getting a bit scary.
Yeah.
Let's lighten the mood and talk about what we can do to prevent this arterial apocalypse.
Okay.
Our sources laid out the risk factors for hypertension.
Yeah.
Like pieces of a puzzle.
That's a great analogy.
Fine.
It's not just about one thing. It's about the combination of factors that come together to create the perfect storm for hypertension.
Yeah.
Age is a big one.
Okay.
As we get older, our arteries naturally become a bit stiffer.
Yeah.
Like those old highways that haven't been repaved in a while.
But it's not just an old person thing, right?
Absolutely.
Even young people can have hypertension.
Absolutely. That's where family history comes into play.
Okay.
If your parents or siblings have high blood pressure, you're more likely to develop it too.
Okay.
It's like inheriting a predisposition for congested highways.
So it's partly about the roads you're born with.
You could say that.
And then there's lifestyle. I know our Elite Wellness Studio audience is probably familiar with the impact of things like obesity.
Right. Obesity is like adding extra lanes of traffic to those already crowded highways. For every extra pound of fat, your body creates miles of new blood vessels.
Wow.
Making your heart work much harder to pump blood through them all.
So it's like adding more cars to the road without widening the highway itself. And then we can't forget about the dynamic duo of salt and potassium.
Yeah, that's a good one.
Oh, yes. Salt, the notorious blood pressure villain.
Too much salt is like a traffic jam magnet.
Okay.
It causes your body to retain water, which increases blood volume and puts more pressure on those artery walls.
So it's like adding more cars to the road without widening the highway.
Exactly.
Potassium, on the other hand, is like a traffic director.
Yes.
Helping to balance out the effects of sodium and keep things flowing smoothly.
That's a good way to put it.
So it's all about maintaining that delicate balance between sodium and potassium.
Exact.
And for our Elite Wellness Studio audience, this is where things get empowering.
Absolutely.
We have the ability to influence many of these risk factors.
That's right.
We can choose to eat a healthy diet, get regular exercise, and manage stress.
Exactly.
We're not just passive passengers.
Yeah.
We're in the driver's seat.
We are.
Speaking of stress, our sources mention that it can also contribute to hypertension. It's like those road rage incidents that cause sudden traffic backups.
You got it.
Okay.
Chronic stress is like driving in rush hour all the time.
Yeah.
Your body is in a constant state of alert.
Right.
And your blood pressure keeps spiking.
So it's like those drivers who are constantly honking their horns and weaving in and out of traffic.
Yes.
Not a recipe for a smooth ride.
Not at all. But unlike those aggressive drivers, we have the power to choose a calmer, more peaceful route.
Okay.
We can practice stress management techniques like yoga, meditation, deep breathing, anything that helps us relax and lower those stress levels.
And those techniques are like those scenic detours that take you off the crowded highway and onto a peaceful back road.
Exactly.
So we've talked about risk factors.
Yes.
But I think it's time to face the music and talk about the potential consequences of uncontrolled hypertension.
Okay.
What are the complications that can arise when those arterial highways are constantly jammed?
This is where things can get serious. It's not just about high numbers on a blood pressure reading.
Right.
It's about the potential damage to your organs and overall health.
So it's like those traffic jams eventually leading to accidents and road closures.
Yeah.
Disrupting the entire transportation system.
Exactly. High blood pressure can damage your arteries, leading to a cascade of health problems, like a domino effect with one problem triggering another.
And heart disease is a major concern, right?
Absolutely. Hypertension forces your heart to work harder, pumping against that increased pressure. This can lead to an enlarged heart or heart failure.
Yeah.
It also increases your risk of a heart attack.
And there's the risk of stroke.
Right. High blood pressure can damage the blood vessels in your brain.
Oh, gosh.
Making them more likely to rupture or become blocked.
Okay.
It's like a major accident on the highway leading to your brain.
And our kidneys aren't spared either, are they?
No, unfortunately.
Oh.
High blood pressure can damage the tiny blood vessels in your kidneys, making it harder for them to filter waste products from your blood.
Mm-hmm.
This can lead to kidney disease or even kidney failure.
So it's not just about the numbers.
Right.
It's about the long-term impact on our overall health.
Exactly.
So.
Untreated hypertension can have a cascading effect, impacting multiple organs and systems in your body.
Okay, we've covered a lot of ground here.
Yes, we have.
Let's move on to something a little more hopeful.
Okay.
How we can diagnose and treat hypertension.
All right.
Diagnosing hypertension is relatively straightforward.
Yes, it is.
It involves taking multiple blood pressure readings over time.
That's right.
So it's like checking the traffic report on a regular basis to see if those highways are consistently congested.
Exactly.
Ideally, these readings should be taken in a calm setting.
Yes.
Because stress can artificially elevate your blood pressure.
That's right.
You don't want a momentary road rage incident to skew the results.
Exactly.
That makes sense.
Yeah.
Now let's talk about treatment. Is it all about medication, or are there other options?
Not necessarily. While medication can be a valuable tool in managing hypertension,
Okay.
it's not always the first line of defense. In fact, for many people, lifestyle changes can be incredibly effective in bringing their blood pressure down to a healthy level.
That's encouraging to hear.
Yeah.
It means we have some control over this.
Right.
It's not entirely out of our hands.
Exactly. Think of it this way. Medication is like calling in a tow truck to clear a major accident on the highway, while lifestyle changes are like implementing better traffic flow strategies to prevent those accidents from happening in the first place.
So it's about addressing the root causes, not just treating the symptoms.
Precisely. And this is where our Elite Wellness Studio audience has a real advantage.
Right.
You're already familiar with the power of healthy habits.
And our listeners are probably eager to hear about those specific strategies.
Sure.
Let's start with diet.
Okay.
We've talked about the DASH diet, but can you break it down for us?
Sure.
What does it actually look like in practice?
Imagine a diet designed specifically to combat high blood pressure.
Okay.
That's the DASH diet. It's not about deprivation. It's about making smart choices that nourish your body and support healthy blood pressure.
So what are some of those smart choices? What should people be eating more of?
The DAS diet is all about abundance.
Okay.
Think colorful fruits and vegetables, hearty whole grains, lean proteins, and healthy fats. It's like a vibrant farmer's market spread on your plate.
Okay, so we're talking leafy greens, berries, nuts, seeds, fish, chicken, beans, lentils, all that good stuff.
Exactly. These foods are packed with nutrients like potassium, magnesium, and fiber, which play a crucial role in regulating blood pressure.
And on the flip side,
Sure.
Are there foods we should be limiting?
Well,
what are the traffic jam culprits in the dietary world?
The main offenders are processed foods, sugary drinks, saturated in trans fats, and of course excess sodium. It's not about eliminating these foods completely, but rather being mindful of your intake and making healthier swaps whenever possible.
So instead of that bag of chips, maybe opt for some air-popped popcorn.
Exactly.
Or some raw veggies with hummus.
That's a great idea. And don't underestimate the power of reading food labels. Pay close attention to the sodium content, especially in processed foods.
That's a good reminder.
Yeah.
It's amazing how much sodium can be lurking in seemingly innocent foods.
It really is.
Yeah.
But with a little awareness, you can make informed choices that support your blood pressure goals.
Now let's talk about exercise. What role does physical activity play in managing hypertension?
Exercise is like a natural decongestant for those arterial highways. It helps improve blood flow, strengthens your heart, and helps you manage stress. All crucial factors in maintaining healthy blood pressure.
So what types of activities are most beneficial?
Anything that gets your heart rate up and your blood pumping is a good starting point. Think brisk walking, jogging, swimming, cycling, dancing, even gardening. It all counts.
So it doesn't have to be super intense or require a gym membership?
Not at all. The key is to find something you enjoy and can stick with consistently. It's about making movement a part of your daily routine.
And for those just starting out, what's a good approach? It can be intimidating to jump into a strenuous exercise routine.
Start slowly and gradually increase your activity level over time. Even 10 minutes of walking a day is better than nothing. And as you get fitter, you can gradually increase the duration and intensity of your workouts.
It's about finding your own pace and listening to your body.
Exactly. And remember, exercise is a journey, not a destination.
Yeah.
It's about making sustainable changes that you can maintain for the long haul.
We've talked about diet, exercise.
Yes.
And now let's delve into stress management. I think we can all relate to the feeling of our blood pressure rising during stressful situations.
Absolutely. Stress is a major contributor to hypertension.
Right.
It's like those road rage incidents we talked about earlier.
Yeah.
It causes a sudden surge in blood pressure that over time can lead to chronic hypertension.
So finding healthy ways to cope with stress is essential.
It really is. And it's about more than just relaxing activities like yoga or meditation.
Okay.
It's about cultivating a mindset that helps you navigate life's challenges with more ease and resilience.
So it's about building those inner stress buffers.
Yes.
To protect ourselves from those sudden spikes in blood pressure.
Exactly. It's about finding what works for you, whether it's spending time in nature, listening to music,
Right.
connecting with loved ones, or practicing mindfulness.
It's about giving yourself permission to prioritize self-care and well-being.
Absolutely. And remember, stress management isn't about eliminating stress completely. It's about learning to navigate those stressful situations in a healthier way.
It's about becoming a more skilled driver on those arterial highways.
Precisely.
Able to handle those unexpected detours and traffic jams with more grace.
Now, we've talked a lot about lifestyle changes.
Yeah.
But I know some listeners are probably wondering about medication.
Yeah.
When does it become necessary to bring in those tow trucks to manage hypertension?
That's a great question. What are the factors that determine whether medication is needed?
Medication is typically recommended when lifestyle changes alone aren't enough to bring your blood pressure down to a healthy level. It's also often prescribed for people with certain medical conditions or who are at high risk of complications from hypertension.
So it's a decision made on an individual basis, taking into account the person's overall health and risk factors.
Exactly. And it's important to remember that there are different types of blood pressure medications, each working in different ways to lower blood pressure.
This sounds like choosing the right medication is a complex process.
It can be.
Okay.
Your doctor will consider your specific health history, risk factors, and other medications you're taking to determine the best option for you.
And it's important to emphasize that medication is not a one-size-fits-all solution.
Right.
What works for one person may not work for another.
That's right. And it's crucial to follow your doctor's instructions carefully and take your medication as prescribed. Don't stop taking your medication without talking to your doctor first, even if you feel better.
It's like sticking to the prescribed route, even when you think you know a shortcut.
Exactly. Trust the expert navigation in this case.
Right.
And even if you are on medication, remember, those healthy lifestyle habits we've discussed are still important.
So it's about using all the tools available, lifestyle changes, and medication to achieve the best possible outcome.
Precisely. They work synergistically to manage hypertension.
Speaking of managing hypertension, let's talk about the importance of monitoring.
Okay.
Knowing your numbers is key, right?
Absolutely. Regular monitoring is like checking the traffic report.
Right.
It gives you a snapshot of what's happening in your body and helps you make informed decisions about your health.
So how often should people be checking their blood pressure?
Well, that depends on your individual risk factors and health history.
Okay.
If you have high blood pressure, your doctor will likely recommend checking it more frequently.
Right.
Perhaps even daily.
And for those with normal blood pressure, what's a good rule of thumb?
It's still a good idea to check it at least once a year.
Okay.
Or more often if you have any risk factors for hypertension.
And how can people check their blood pressure?
Well,
is it something they can do at home?
Absolutely. You can buy home blood pressure monitors at most pharmacies.
Okay.
Just make sure to choose one that's been validated for accuracy.
And what about those blood pressure machines you see at the grocery store or the pharmacy?
Yeah.
Are those reliable?
While those machines can provide a general idea of your blood pressure, they're not always as accurate as home monitors.
Right.
Or the readings you get at your doctor's office.
So it's best to use them as a starting point, but not rely on them solely for monitoring.
Exactly. And if you notice any significant changes in your blood pressure readings, be sure to consult with your doctor.
It's like noticing a sudden increase in traffic on your usual route. It's a sign to investigate further.
Precisely. Now, we've covered a lot of ground today.
Yes, we have.
From the basics of blood pressure
Yeah.
to the complexities of diagnosis and treatment.
It's been quite a journey exploring those arterial highways and all the factors that influence traffic flow.
And we've learned that hypertension is a serious condition, even if you don't feel any symptoms.
But the good news is that we're not powerless.
That's right.
By understanding hypertension, we can take steps to prevent it, manage it, and live healthier lives.
Exactly. We've talked about the power of lifestyle changes. Those simple yet profound adjustments to our daily habits, that can make a world of difference.
And we've explored the role of medication, emphasizing that it's not a quick fix.
Right.
But rather a tool to be used in conjunction with those healthy habits.
Exactly.
And of course, we've highlighted the importance of regular monitoring.
Yes.
Knowing your numbers and staying attuned to any changes in your body's traffic patterns.
That's right.
It's all about taking an active role in our health, becoming informed navigators of our own well-being.
Precisely. And before we wrap up this segment, I want to leave our listeners with a thought-provoking question.
Okay, I'm intrigued. What is it?
Given everything you've learned today, what's one small change you can make this week to prioritize your heart health?
That's a great question to ponder.
Yeah.
It doesn't have to be a huge life-altering change.
Right.
It could be as simple as swapping out that sugary soda for a glass of water, adding an extra serving of vegetables to your dinner, or taking a 15-minute walk during your lunch break.
Exactly. Small changes consistently applied can lead to significant improvements in your overall health and well-being.
It's like making those small adjustments to your driving habits, slowing down, being more mindful, choosing scenic routes that over time can lead to a smoother, more enjoyable journey.
Precisely. And remember, this is just the beginning of the conversation.
Right.
We encourage you to do your own research, talk to your doctor, and continue exploring ways to take control of your heart health.
Knowledge is power.
It is.
And now you have the knowledge to make informed decisions about your health.
We'll be back after a short break to wrap up our deep dive into hypertension. Stay tuned.
Welcome back. As we wrap up our deep dive into hypertension, it's a good time to reflect on what we've learned.
Yeah.
And how we can apply it to our lives.
You're absolutely right. It's not enough to just understand the mechanics of blood pressure.
Right.
We need to translate that knowledge into action.
We've uncovered the silent threat of hypertension, explored the factors that contribute to those traffic jams in our arteries, and learned that even if we don't feel any symptoms, the damage can be significant.
And that's the part that often catches people off guard. They think, I feel fine, so my blood pressure must be fine.
Right.
But as we've discussed, hypertension is a master of disguise.
It's like that saying, the quietest rooms are often the most dangerous.
Precisely. But here's the empowering part.
Okay.
We're not helpless victims. We have the power to take control, to make choices that support our heart health.
We've talked about the power of those everyday choices.
Yeah.
What we eat, how we move our bodies, how we manage stress.
That's right.
Those seemingly small adjustments can have a ripple effect on our overall well-being.
Think of it this way. Each healthy choice is like choosing a less congested route.
Okay.
A smoother path for your blood to flow through.
And over time, those choices create a whole new landscape for your heart health. It's like trading in that old pothole-ridden highway for a brand new state-of-the-art expressway.
Exactly. And remember, it's not about perfection.
Right.
It's about progress.
You don't have to become a marathon runner or gourmet chef overnight.
Nope.
It's about those small, sustainable changes that you can stick with for the long haul.
Adding an extra serving of vegetables to your plate, taking the stairs instead of the elevator, finding 5 minutes to close your eyes and breathe deeply. Those little things add up.
It's like those little detours we take to avoid traffic. They might seem insignificant in the moment, but they can make a big difference in our overall journey.
And for those who need extra support, medication can be a valuable tool.
Right.
It's not a sign of weakness.
Yeah.
It's about working with your body to achieve optimal health.
It's like having a skilled mechanic on hand to help you keep your engine running smoothly.
Precisely. And remember, even if you are on medication, those healthy habits we've discussed are still important.
So it's about a holistic approach, combining lifestyle changes with medication to create a comprehensive plan for managing hypertension.
And let's not forget about monitoring the regular check-in with your body's traffic patterns.
Knowing your numbers empowers you to make informed decisions about your health.
Absolutely.
It's like having a GPS for your heart guiding you towards a healthier destination.
Exactly. And if you notice any sudden changes in your blood pressure, don't hesitate to reach out to your healthcare provider.
Right.
They're your co-pilots on this journey.
So as we wrap up this deep dive, we hope you're leaving with a sense of empowerment, not fear.
Hypertension is a serious condition, but it's not a life sentence.
Right.
With knowledge and action, we can take control of our heart health.
Remember, small changes can make a big difference.
They do.
Start where you are, use the resources available to you, and keep moving forward on your path to a healthier, happier life.
And never underestimate the power of knowledge. The more you understand about your body and how it works, the better equipped you are to make choices that support your well-being.
Thanks for joining us on this deep dive into hypertension. Until next time.